In this skit, we will assess how critical thinking can benefit the life and work of a doctor and medical student. To put it into context, we will see Andrew, a medical student, seeking advice from Dr. Tatum on how to diagnose a patient he is seeing in an emergency case.
Hey, Dr. Tatum, I just saw a patient and I have a few questions for you if you can help me diagnose him.
Okay.
Well, we have a 65-year-old man and he's on blood thinners. And he came in today complaining of a pretty bad headache.
Okay. Well, my first instinct, or my purpose, I should say, would be to see if he has a head bleed.
All right, so what questions do you think I should ask to figure out whether or not he has a head bleed?
Okay, well, you would ask things like, is he a drinker, or does he smoke, or does he do recreational drugs, or has he fallen recently? Because all of these things can kind of add into to head bleeds and make them worse or whatnot.
All right, so what would you assume is wrong with him then?
Well, depending on how he asked, if he fell, I would say yes, he definitely probably does, and he needs to get checked out immediately. So I would assume, depending on how he answers, that he may or may not have one.
The doctor questions the medical student on the patient and tries to formulate assumptions and inferences, and distinguish between them to have a diagnosis ready for the next step of the treatment process. It is necessary to distinguish between assumptions and inferences. An assumption in a medical field relies on previous cases, studies, and experimentations, helping the doctors to tap into known information and produce relevant thinking towards the case. Inferences then build on the assumptions, helping the doctor personalize the diagnosis to the patient based on the questions and his trial of the patient.
All right, well, how would you interpret going about treating him?
Okay. Well, again, depending on how he answers, I would say that he probably needs to have a CT immediately to rule out or rule in a head bleed.
All right, well, what are the implications of sending him to get the CT or just this line of thinking in general?
Okay. Well, having this well-defined thought process would be the kind of the defining line between whether or not we would come to the conclusion that he has a head bleed or not. Because we have these questions that we ask that tell us, yes, he probably does, or no, he probably doesn't. And so if we didn't have this line of thinking, we may miss a head bleed, and the patient could die in minutes. But because we have this kind of process, this thought pattern, we could potentially catch one of those early and save his life.
All right, great. Thank you.
No problem.
So the point of this film that we were trying to illustrate is that having a well-defined critical thinking process will greatly benefit the life of a doctor. Because if that doctor has a way that he thinks and it's specifically refined, then he can catch diseases or catch illnesses very early that could potentially save that patient's life.
Hey, Dr. Tatum, I just saw a patient and I have a few questions for you if you can help me diagnose him.
Okay.
So what do you think the purpose should be in figuring out what's wrong with him? Oh, shit. I forgot to tell you what was...